Hello, welcome back to the channel. Today's news takes us to Johannesburg, where things got tense and emotional at the Rosettenville clinic. Police were reportedly called to open the gates for a group of undocumented foreigners who were allegedly denied access to the clinic. This incident has sparked outrage from many South Africans who feel that the country's health system is under strain and that laws are being bent in ways that don't make sense for locals. Please stay with us till the end so you can hear where this news came from and decide for yourself after verifying. Let's get into it. So, what exactly happened? According to several eyewitnesses and reports coming out of Johannesburg, the group of undocumented foreign nationals, mostly women, was seen waiting outside the Rosettenville clinic early in the morning. The clinic staff allegedly refused to open the gates and allow them inside, which led to tension and confusion. Things escalated quickly when the police were called, not to remove the group, but to open the gates and ensure they got inside the clinic. Now, many South Africans are asking, why are the police being used to assist people who are in the country illegally, instead of enforcing immigration and health access laws? Rosettenville residents, who've been raising concerns about undocumented foreigners accessing public services, said they felt undermined. Some people who arrived early and stood in line to get medical care were shocked to see others with no documentation being given access, allegedly ahead of them. And this raises serious questions about fairness, service delivery, and how public resources are being stretched. Let's not forget, the Gauteng Health Department has previously stated that hospitals and clinics are overwhelmed, with many foreign nationals, both legal and illegal, seeking treatment. In some facilities, local South Africans wait hours, even days, to get help, while resources like medicine, beds, and nurses are spread thin. A nurse at the Rosettenville clinic, who asked not to be named, reportedly confirmed that the police were indeed called in to ensure order and safety, not necessarily to escort the undocumented group in. But people on the ground say that's exactly what it felt like, police helping those who should be facing deportation or immigration review. The scene caused a lot of frustration. Some locals shouted that they'd been waiting for hours, only to be told there's no space. One woman, a single mother from Rosettenville, said, "I pay my taxes. I vote. I live here legally. But I get turned away while people who can't even show ID are helped fast. It's heartbreaking because no one wants to see another human being turned away when they are sick or in pain. But it's also frustrating when law-abiding South Africans, especially the poor and working class, are told there's no medicine or staff, yet people with no paperwork are still being accommodated." The broader issue here is not just about one clinic or one day. It's about how South Africa manages its borders, its healthcare resources, and the balance between being humane and being responsible. Yes, we must treat people with dignity. But at the same time, there has to be order. A country cannot provide unlimited services to an unlimited number of people, especially when its own citizens are already struggling. The Department of Home Affairs has been under fire for not doing enough to manage undocumented migration. And the SAPS, the South African Police Service, it is also walking a tightrope between maintaining order and enforcing immigration law. When police are called to open clinic gates for undocumented people, it blurs the line between humanitarian help and enabling lawlessness. It's worth asking, are our public institutions still in control? Or have we reached a point where pressure from activist groups and international organizations is overriding local policies? This case in Rosettenville might seem small to some, but it's symbolic of a much larger problem. South Africans want answers. They want services to work. And they want to feel like they matter in their own country. The feeling of being sidelined or placed second in line can lead to resentment, not just toward foreign nationals, but toward the state itself. We must also be careful not to allow these issues to spark xenophobia or violence. That's not the solution. But there must be transparency. People deserve to know the rules, and those rules should apply to everyone, regardless of where they're from. The Department of Health has not released an official statement on this particular incident yet. The Gauteng Department of Health has said in the past that no one should be turned away from receiving emergency care, but this case involved general clinic services, not life-threatening conditions. The police, too, have not commented officially. But questions are being raised about whether they acted outside their mandate, and whether other clinics will soon face similar sins if nothing is done. We'll be keeping a close eye on this situation, and we encourage viewers to do the same. So now, Mzansi, what do you think? Let us know in the comments. Take care and stay informed.